representatives that are here, both in Fiji, Dr. Wendy Snowden in your group, and also from around the world. And our colleagues from all the stakeholders here in Fiji, from Fiji Inland Revenue and Customs Authority, and also the other stakeholders that are here, and our Minister of Health staff and members of the media. And the representatives of MFET if they are here, and also the police force. This year marks the 17th year of Fiji's commitment and support towards the WHO's Framework Convention on Tobacco Control, or FCTC, as we have heard today. And usually when I've seen this written, it's often written as WHO FCTC. And that's what really it's all about. And signed in 2003, we were the first developing country, and Fiji has remained consistent in our efforts over the last 17 years to stand with the rectified convention and protocol, and to also rise above the tobacco industry's documented history of marketing and work that they are doing in that regards, and together develop innovative approaches that will see Fijians protected and safeguard them from the harmful effects of tobacco products. And I say it here in my former role, as a surgeon. One of the work that I used to do was look after people with peripheral vascular disease and revascularizing limbs that have been affected by peripheral vascular disease. And almost often, if you look at the studies initially done around peripheral vascular disease by Zarin and his colleagues back in 1970 and all throughout the years, the association that is between cardiovascular disease and smoking has been proven even since back then. And as we all know, the challenges that have remained to be able to bring it to the fore. And it continues to be, and tobacco continues to be one of the leading causes of morbidity and mortality across the globe. With over 8 million deaths worldwide, this makes tobacco as an epidemic of sorts, and one of the largest public health threats. And as I've alluded to earlier, there is irrefutable evidence of the devastating effects of tobacco to individuals and families alike. It is highly addictive and causes all ill health and death to users. Even non-users exposed to second-hand smoke are affected, and this is thought to be over just 1 million people dying from second or being exposed to second-hand smoke globally a year. And also children, and we often talk a lot about pregnant mothers and the effect that they have on their children if they smoke. It's interesting because in Parliament one day I was stopped by a very well-learned gentleman who was young and obviously a professional, and he said to me, I can't get through to my wife that she's pregnant and she's in second or third trimester of pregnancy, that she needs to smoke. She needs to stop smoking because of the effect that it will have on our child. I'm not sure which one was it, first, second, or third, but you can see the challenges that happens, and obviously I'm already thinking about the effects that it will have on the unborn child. The most recent global school-based health survey in Fiji in 2016 found that over 50% of children aged from 13 to 15 have been exposed to tobacco smoke in public places and homes in the past week. On that note, from a Ministry of Health perspective, we made it very clear that our institutions and our facilities are smoke-free. We also accept that there are members of the public that may wish to smoke, and we politely ask them to do it outside of our facilities and outside our premises, because we believe in actually leading by example and actually walking the talk in regards to tobacco smoking. The total cost estimated in the Western Pacific region averages about 2.6% of the national GDP in the 15 countries that were surveyed in our region. This consequently has tremendous impact on the progress of economic development and growth, because global data indicates an alarming majority of deaths from tobacco in developing countries across the earth happen within the economically productive age bracket of 30 to 69 years. Social impact, such as employment, school dropout, poverty, addiction, and all the other issues around social problems become an issue, and the most vulnerable and severely affected could be the children and the elderly. And again, Some of them can be indirect effects, and affected the most vulnerable become even more vulnerable, so as to speak. In Fiji's efforts to ensure that suffering caused by tobacco products continue to be suppressed, the government in 2010 passed the Tobacco Control Act with the tobacco regulation in 2012. The Fijian government, through its annual budget, have had a consistent increase in tobacco taxation since 2013, which had resulted in a significant increase in prices of tobacco products, which subsequently acts as a deterrent to users over the last years. With the government's endorsement of the tobacco regulation in 2012, Fiji has instituted drastic measures towards its tobacco control work that includes the following. 1. Introducing graphic health pictures on all tobacco packaging that covers 30% of the front and 90% at the back. And I say this with interest because some have said to me, and I'm not sure whether they were joking, but they would say, I prefer so-and-so tobacco product that has the lung cancer picture on it, or I prefer the so-and-so tobacco product that has the stroke on it. But in a way, I'm glad that the pictures are beginning to make an effort and in effect, and I'm hoping that the effect will be helpful in being able to bring deterrence. Secondly, we've had annual registration of wholesalers and distributors, annual licensing for manufacturers and importers, which carry a hefty amount, and restrictions of public places from smoking. That includes workplaces, includes areas where public has access, eateries, and designated areas in taverns, bars, and nightclubs. And for me personally, as a Minister of Health, I'm very interested in making sure that organizations become an area that are promoting health. I'm well aware of the fact that majority of us that go to work and our children that go to school spend a lot of our waking time in our places of work, in our places of school. And it's important, and one of the things that I've been talking to the Permanent Secretary about is that we need to now start looking at working with organizations and churches and communities so that we can promote health. And one of the things we want to promote is the restrictions and the refraining from smoking in public places and in organizations, so that we can all ensure that everyone has the ability to have good health. There's been a significant increase on the trainings done for the tobacco control officers and prosecutors over the years, and also multi-stakeholder meetings that have happened. And I've been very fortunate to have attended at least one of these, including regional meetings. And this has consequently resulted in increasing number of offenders apprehended and the subsequent increase in cases that have ended up in court. I've also been very pleased to see members of the public actually calling a tobacco control unit and telling us about instances where they feel that there has been infringement, so that we can be able to act on it together with our police department. With our current remodeling plan, much of this service will be decentralized, and we're intending to open up more tobacco enforcement units at the sub-regional national level. While there are significant progresses in Fiji's compliance on the FCTC, global data reveals that about 12% of all tobacco is sourced from illicit streams, and this amounts to around 1 in every 9 cigarettes. Tax avoidance and tax evasion continues to increase. I'm very happy and glad to see our colleagues from FILCA here with us today, and we're working very hard with them in this regard because they undermine the effectiveness of tobacco control policies. These activities range from legal actions such as purchasing tobacco products from lower tax jurisdictions to illegal ones such as smuggling and counterfeiting. Lately, Fiji has experienced an increase in chewing tobacco, which is an illegal product, and counterfeit tobacco products which do not meet the requirements of our legislation. We are slowly witnessing the presence of unregulated emerging tobacco products, such as Shista and other products like e-cigarettes within our borders, and Fiji's step to becoming a party to the World Health Organization's protocol to eliminate illicit trade in tobacco products in 2019 is timely and prudent. And around this time last year, we convened a multi-stakeholder consultation to strengthen Fiji's tobacco enforcement work, specifically around the areas of illicit trade of tobacco products at our borders and within. A major outcome in that meeting is the formation of what we currently have, the National Tobacco Control Multi-Stakeholder Task Force, which includes and compromises the FILCA, which is here today, Fiji Police Force, local municipal councils, and health. And I can also say that I've seen a lot more interaction happen over the last year, Chief Health Inspector, with this stakeholder commitment that we have from all our partners that are working with us in this regard. Following the signing of the MOU early this year between our ministry and FRCS, that gives us access to the FRCS automated system of customs and data world, or ASYCUDA world, on imported and exported products. This is a major breakthrough in our efforts to ensure that what comes in and out of our borders is regulated and conveniently tracked and traced. And this data sharing platform will give us access to first-hand data and information on movements of commodities, which will easily result in the apprehension of those perpetrators of illicit activities. And I take this time to acknowledge and the support of our partners, the Fiji Police Force, the municipal councils, the Fiji Revenue and Customs Service, that has ensured the formation of our broader collaborative cross-national and sectoral platform of addressing illicit tobacco trade. And this project, through the Convention Secretariat, UNDP and WHO, will no doubt enhance our efforts in achieving the articles in the FCTC and the protocol, and surely align us well in the 2030 Sustainable Goal developments. With that said, I have much pleasure in officially launching the Framework Convention on Tobacco Control 2030 Fiji project. Navalit.
Thank you, Moderator. Your Excellency, the Minister of Health of Fiji, Excellencies, esteemed colleagues, dear participants. Thank you very much for your participation today in the launch of the FCTC 2030 project in Fiji. As you know, tobacco is one of the greatest public health threats the world has ever faced. And we can affirm that even now, in the midst of a global pandemic. Tobacco kills more than 8 million people every year, with 1.2 million of those deaths occurring among non-smokers who die from exposure to secondhand smoke. The evidence is clear. Up to half of all long-term smokers will die of tobacco-related diseases, many of them at a premature age. More than 80% of the world's smokers live in low and middle-income countries. The situation is likely to get worse because developing countries, including Fiji, are growth markets for the tobacco industry. And as we all know, the tobacco industry increasingly targets women and youth. Tobacco not only destroys lives, it impoverishes families, slows economic progress, imposes an immense burden of health system and causes harm to the environment. Ladies and gentlemen, this is a human-made epidemic with far-ranging consequences. But those consequences are entirely preventable. It also is an epidemic driven by an industry attempting to maximize profit by increasing the number of people dependent on their products and on nicotine. After considering the compelling evidence, WHO member states in 2003 adopted the WHO Framework Convention on Tobacco Control in an effort to end the global tobacco epidemic. The treaty legally binds governments to implement effective tobacco control measures that will improve health and well-being and ensure a better future for all. The WHO FCTC is also an accelerator for sustainable development. In the 2030 Agenda for Sustainable Development, the inclusion of Target 3.8 on strengthening the implementation of the WHO FCTC recognizes the tremendous burden tobacco places on health and health systems and the threat it poses to sustainable development. Strengthening implementation of the WHO FCTC will support the achievement of the Sustainable Development Goals, including those that call for alleviating poverty, hunger, and inequalities, increasing productivity, and improving air quality, aquatic life, and our ecosystem. Fiji, in October 2003, was the first developing country to ratify the WHO FCTC. Since becoming a party to the treaty, Fiji has made significant progress in implementing the treaty. A tobacco control law, strong regulations, and effective enforcement are in place in Fiji. And in an effort to ensure legal instruments remain effective against the ever-evolving tactics of the tobacco industry, regular amendments are being made to strengthen those laws and regulations. As a result, Regulation on smoke-free places are enforced, advertising is banned, sales are restricted, and graphic health warnings are required on tobacco packs. The taxes in place on tobacco products make cigarettes less accessible to youth and low-income earners in Fiji, but even higher tobacco taxes are needed to bring Fiji up to the minimum levels recommended by WHO. Well done, Fiji. Fiji should be commended for its tobacco control efforts, but more work must be undertaken to fully protect people from the deadly impact of tobacco. I'm pleased to know that with the assistance of the FCTC 2030 project that we are launching today, we will be able to support the Ministry of Health and Medical Services in developing systems to address violations of the law, in improving governance by preventing tobacco industry interference in public policy, and in generating much-needed national-level evidence on the economic impacts of tobacco use. Through these efforts, we are committed to support Fiji, and it continues to implement the WHO FCTC and end the use of tobacco nationwide. As the world continues to struggle with the devastating COVID-19 pandemic, there will be economic ramifications for all countries. Let us use this opportunity to redouble our efforts to curb the tobacco epidemic. There has perhaps never been a better moment to quit tobacco use, and to also position tobacco taxes as price policies as part of the national COVID response. Tobacco control has an important role to play in the COVID recovery process as we strive to build healthier, more resilient societies and sustainable economies. I'm confident that despite these difficult times, Fiji will manage to make the most of the FCTC 2030 project and bring about lasting change that will improve the health and well-being of its people. I will conclude by offering our sincere congratulations to Fiji for being selected as our FCTC 2030 project country. Your Excellency, please be assured of the Convention Secretariat's full support for your country in this endeavor. Thank you very much, and congratulations again for a successful launch.